in a different direction.
Toby, our guest host today is Bill George, who's here as well, and I know you're good friends with him.
Yes.
Bill, you've been looking at what's been happening with this. What questions would you have for Toby?
Toby, my concern has to do with lifestyle, because it seems like the Obamacare Act, we want insurance for all Americans, but the real concern is that lifestyle accounts for more than 50% of health care costs. And you've been very outspoken on subjects which a lot of politicians are not. Tell us what you think needs to be done to deal with issues like obesity, the diet, nutrition, lack of exercise in America, because I see the health declining of people, and that just means we put more people into the hospital and focus more on disease care instead of health care.
Well, we're really concerned about particularly the epidemic of obesity, which now accounts for 10% of the healthcare costs in the United States. And it continues to get worse, although it doesn't seem to be going up quite as fast as it has in the past. We're going to have all sectors of society, including education, healthcare, government, and all involved, and including the food industry, in beginning to understand how we educate people and have appropriate food and exercise so we can halt this tremendous epidemic, which is going to consume us and may well shorten lifespan for people in the United States. It's an economic factor, it's a social factor, and it's a longevity factor.
We have Indra Nooyi, who's joining us in the next hour, Toby, and we've been looking at what some of the companies have been doing, some of the food companies have been doing. What would you say about those efforts? I mean, they've been trying to cut back on some of the calories, offer low-calorie things. Is it helping? Is it enough?
Well, I think it's a step in the right direction, but I mean, the food industry is huge. Indra has been very outspoken about this and has tried to take a lead in this, but this is a very big industry. Not only do we have to change the food that we eat and have a lot of people in the industry do it, we have to educate people about what they can eat appropriately and what exercise needs to be associated with that.
Toby, he's your guest, right, Bill?
Yeah.
Toby, just in terms, whenever you come on, you are a backer of Obamacare. And I mean, I think you say the law is not perfect, but it's a big step and a long process to come. Are you a backer of Obamacare, Bill George?
No.
I see a total disconnect, and I look at what you say, Toby, about the good things that can happen, and then I read CKE Restaurant yesterday. The guy said it's easier for his franchisees to open a restaurant in Siberia than in the United States now. So you're getting a little bit of a payback for what you're involved with, Cleveland Clinic, healthcare. You're seeing a few positive things from Obamacare. Do you take into account at all what it's doing to the entire jobs picture in the United States?
Well, I'm concerned about the job picture because one of the biggest factors in job growth since 2000 has been the healthcare industry. Yeah. And, you know, we're going to see less money in the healthcare industry. And that's going to involve cutting back on jobs. And every CEO that I talk with around the country is reducing the number of FTEs.
Maybe there's a better way to go about it. Bill has are you guys still friends? Don't you talk to him about this?
So my concern is incentives, because, you know, you guys provide, Mayo, other places, F&E Anderson, provide the best health care in the world. There's no one can compete with the top U.S. institutions. But are the incentives there? The incentives are for doing procedures, for giving more tests, for having more office visits. I'm concerned about consumer incentives. Every single Medtronic program we had for the last 20 years is based on incentives for staying well, staying healthy, and you pay less. And yet in the Obamacare, these incentives haven't come to the fore. I know they're in the back of the bill, but I'm concerned that the exchanges are going to overwhelm it, and people are not going to have the incentives to stay healthy.
Well, one of the things that we're helping Senator Wyden and Senator Portman do is to bring those incentives into the Medicare population for people keeping well and a financial incentive. And I hope that this gets added on to the bill because I think it would be a major positive step.
Toby, I just want to go back to food for 1 second. Maybe Bill can go in on this too because we're going to have Indra on. Do you think there are market incentives or enough market incentives to push the food companies to do what you want them to do, or do you think it ultimately needs to be regulated?
I don't think there's enough incentives right now to do that. I think it's going to take more time, and I think, but I think the pressure has got to come from the populace, not from the government, and it's going to the private sector.
That's not the answer I wanted.
Sorry.
No, I'm kidding. Being a little bit of a devil. So I can't get you going. I can't get you to tell him he's wrong.
No, I want him to keep speaking out because he's the only one who's got the courage. The president won't speak out on this. He speaks out.
Why don't you tell him Obamacare is not the way to go?
Yesterday we had Jennifer Singh on.
It is what it is. It's the law of the land. We got to make it work. And I think Toby's trying to figure out how to make it work.
Hospitals will be the ones who benefit out of this. And the entire healthcare sector, he likes the hospitals.
Well,
because of Obamacare.
I think we knew we had to change because the health care in the United States was too expensive. This was not a perfect law by any stretch of the imagination, and there are problems that are going to crop up, unintended consequences.
We'll see.
My concern is that we're going to be able to change rapidly enough so that we correct the errors.
We got to run. I apologize. Thank you, Toby.
Thanks, Toby.
Pleasure.
Appreciate it.